Last week we discussed external tibial torsion. It is an underlooked cause of many issues in the lower body and the low back. We discussed a little bit what it is, how you can screen for it on your own. Today we're going to discuss a few more tips, tricks, and recommendations, more recommendations, not so much tips and tricks, on how to deal with this if you do actually figure out that this might be you. So external tibial torsion, if we kind of go back and remember real quick, most individuals' kneecaps, when their feet are pointed directly straight ahead, their kneecaps also point straight ahead. For people who have external tibial torsion, it can be on one side or both sides, and it can be a little bit more on one side than the other as well. But when their feet are pointed straight ahead, their knees are pointed inwards, just like this. So instead of their knees pointing straight, they're pointing in towards the middle. If the knees are pointing in towards the middle, that puts a lot of stress on the inner knee. Also puts a lot of stress on the ligaments on the outside of the knee itself. So one of the recommendations is to hopefully not get into a sport where your feet are locked in straight ahead. There is a very famous U.S. downhill skier who I believe is retired and came back from retirement now, who has been very good, had a very good career, but has had many knee surgeries because she's got this external tibial torsion. You can tell when she's standing, her kneecaps are pointing dead center. But for many of these people, if you're exercising and keep your, especially your lower half strong, you keep the muscles in the hips, the legs, and the feet strong, you can absorb the forces that your body's taking, and you hopefully can make yourself a lot more resilient to injuries. So one of the recommendations we discussed a little bit last week for someone who discovers that they might have this, if it's on one side, like we said, both sides, or kind of a combo of both, is you want to find the angle with your feet when you're doing your athletic activity, your exercise, you're working out, where your knee caps are pointing straight ahead. So if you're running, and we're running just like this and going straight, if you need to be toed out just a little bit to have your kneecaps pointed straight ahead, you're going to run with your toes out just a little bit. That is totally okay, and that's going to be a long-term recommendation for you when you're trying to run, when you're trying to walk. So one of the things that we also see with these individuals is a lot of times they'll start to develop bunions, or the big toe will start to grow towards the four smaller toes on the affected side or side. So they might have one bunion, they might have two bunions. So one of the things that one of the other recommendations that goes along with this is also a under realized issue of why some people actually do get bunions, is they've got this external tibial torsion. They don't quite realize they've got this somewhat normal, abnormal condition in the leg. They can't figure out why they've worked on the big toe. They just can't figure out why it's not shaping up and getting better. So one of the things that comes in very important for some of these people who already have the bunions forming is to get some strength and get some mobility into the feet, into the toes themselves. That can be toe spacers, that can be foot and toe exercises, that can be physical therapy, all the list of different stuff you can find on YouTube and the internet and Instagram. Any of that stuff would hopefully be very handy. If you're having very specific problems, finding a great practitioner is always recommended. If you're in Kansas City, we'd love to help you out. So remember, if you're having issues with that and you've been told to run with your feet turned forward, your job's very easy. Find the position with your feet turned out where kneecaps are pointed straight ahead. The other recommendation on that one is just a lot of times we'll see this with someone who's trying to squat and they're having tons and tons of knee pain. Typically, the tip and the technique for squats is to try to line your kneecaps up in between your first and second toe. Why is that? Because the kneecap for most individuals actually lines up with your first and second toe. So you're going to find the position of your hips, knees, and feet. So the kneecaps, when you're squatting, are lined up with your first and second toe. Because a lot of times when these people squat, it almost looks like their knees are coming in inside their feet. So they really need to work on keeping these out, going in between the toes. And like I said, one of the other long-term fixes, or one of the long-term things to help, not a fix, get you through this thing to do your activity is to actually keep the hip muscles strong. And that's what we're going to be talking about next week.